Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Nita Valens.
Well, hi there, Dr. Darrow.
Yippee-ki-yi-yo. I'm living it up.
You're living it up. That's great. I'm great. You're living it up.
I'm riding the range once more.
Yay. Well, we want our listeners to live it up. So how should we proceed to accomplish that?
Well, the easy way is to listen to this show. And,
call.
And call. And the phone number to get to me and Nita right now is 866-870-5752. And we're here to answer all of your questions about your orthopedic pain, all the muscles, tendons, ligaments, joints, all those things that hurt, especially when the weather's cool. It hurts more. You know why that is, Nita?
Yes, because we're not adjusted to the cold.
No, that was a good try from an intellectual like you. No, it's because the collagen tightens up.
Oh.
Yeah, the ligaments are made out of collagen, the cartilage made out of collagen, muscles, everything in the body is made out of collagen. In fact, our eyes, our blood, our hair, everything has a collagen component. There's different types of collagen. And one of my first books was called The Collagen Revolution. The new book, which I'm going to give out if you call me right now, is called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. And I'm showing this to the camera right now because we're going to record this show. All my shows, not all, but most of my shows are recorded on my website if anybody wants to go there later and look at them. And the website is www.lastemcells.com. That's www.lastemcells.com. And please call us right now. Make this an interesting show. Nita and I have been talking together. How long have you been on the show, Nita?
This is our 13th year together.
Ooh, crazy.
So you were with Dr. Jean for 10 years. That means this show for you, you're in your 23rd year. I'm in my 13th year with you. How about that?
Yeah, good old Dr. Jean. We love you, Dr. Jean. Hope you're doing great. Dr. Jean was a pharmacist who had his own show, and he used to put me on his show several nights a week. And then I decided to start my own show, which I've been doing for a long, long, long time. Anyway, to get a hold of us right now live is 866-870-5752. And I'm going to go to some questions to get the show rocking and rolling till we get some calls. You can interrupt me anytime, Nita.
Okay, I'll just breathe.
Yeah, all you do is breathe. When you breathe, oh my God. Not so loud. I can pick it up when you're subtle.
I know.
But to punish you, which I like to do, I want you to know that I'm terrified of elevators. So you know what I'm going to start doing?
Yeah, you're going to start climbing up those stairs.
Oh my God, I'm going to start taking steps to avoid them. You hit it pretty darn close, Nita.
Very close, very close.
You're on today. So, did you know I got fired from my job at the bank today? Do you know why?
You were late.
No. A woman came in who was kind of unsteady, and she asked me to check her balance, so I pushed her over.
But you're an orthopedic doc. You can't push people over.
Well, there actually is a test we do where we have people stand on one foot with their eyes closed, and we give them a push on the forehead to see how their balance is doing.
Oh, don't do that with me. I'll fall down.
Hey, Nita, did you know where the computer went to go dancing?
The computer went to the frame.
The disco.
Oh.
And did you know I used to hate facial hair, but then it grew on me?
Well, you must have lost your razor.
Nita. Okay, I'm going to give you one more question. You better get this right.
Okay.
You can do it. How many tickles does it take to make an octopus laugh?
1.
Tentacles.
Oh.
All right, I'm going to go to a question.
Okay. Good idea.
Are you ready, darling?
Okay. Well, for people that are just joining us, because some people tune in late, why don't we give the phone number and let you
All
know
right.
about the fabulous free book you're going to get just
All
by
right.
calling the program. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It is Dr. Darrow's latest with over 250 scientific studies.
That's right. These are reviewed studies by doctors, and they tell why regenerative medicine, which is what I do, works, meaning stem cells and platelets, and why surgery can be very problematic. We all know friends who have had terrible things happen during surgery. I've seen it. I've seen it all. And we've seen deaths. We've seen a lot of infections, all that kind of stuff. I'm not telling you not to get a surgery. That's your choice. But my goodness, if it's musculoskeletal surgery, if it's not an emergency, please try regenerative medicine first, because you walk in, you get injected, and you walk out. And we all know the story of my listeners who know that I had shoulder surgery 1994 because I didn't know about regenerative medicine, and I was doing orthopedic surgery and asked my boss to heal it. So he did a surgery, and it came out pretty bad. I had 4 years of misery after that until I self-injected my own shoulder. And he literally healed it overnight. That's not the way it usually happens. It usually takes several weeks of healing before people feel better. Sometimes it's quick, sometimes it's longer. Anyway, I want to go to this question. Can this therapy work for foraminal stenosis? So that's kind of a broad question. This therapy, meaning stem cells and platelets, regenerative medicine. Let's talk about what is foraminal stenosis. The foramen are holes in the vertebrae where the nerves from the spinal cord come out and go down the arms and legs. So if you have what's called sciatica, that can be possibly from foraminal stenosis. Stenosis means squeezing or a small space. So you can have stenosis in the coronary arteries and you get chest pain, angina. When it's in the vertebrae, you get arm pain or leg pain or numbness or tingling, what we call paresthesias. So can my therapy work for this? It depends. Very often people come in and they have, let's say, neck pain or low back pain, and they say, I've got foraminal stenosis. I go, how do you know that? They say, my doctor sent me for an MRI and it shows that. And I asked, do you have arm pain or anything like that, or leg pain? They go, no, I don't. I just have neck pain or back pain. So the diagnosis showing up in the film, MRI, CT scan, X-ray, whatever it is wrong. It's not really wrong. It's right, but it's not the cause of the problem. So we have to be very careful to use our hands to do examinations, find out where the pain is being generated from. And it's very sad that I see so many people get surgeries based on their images, their MRIs, X-rays, or whatever it is. As an example, a woman came in yesterday. She walked in, I watched her walk. She didn't have any limp or anything else. And I said, what's your problem? She goes, I have advanced hip arthritis, and I'm told I have to get a hip replacement. And I said, I just watched you walk in the door pain-free, no limp. Why do you need a hip replacement? She goes, well, I have some pain sometimes. And I said, let me check you out. So I moved her around, and she had pretty good range of motion. Okay? She wasn't in any dire distress, certainly not in a place where I thought she needed a hip replacement. So again, same type of idea. Don't go get a surgery based on a diagnosis that a doctor gives you. Most of the surgeries, in my humble opinion, should not be done, don't need to be done, and can come out worse than what they were before the surgery. So we have to be very careful. So can this therapy work for foraminal stenosis? Can we inject stem cells or platelets and get a person better? It depends. I need to examine them and see what's going on. And there are times when I can't help people, and I just tell them, I can't help you. And often if someone has some kind of radiculopathy from a foraminal stenosis, that means that the radix, or that part of the nerve coming out of the spinal cord through this hole or the foramen, is blocked or stenotic. And then guess what I do? I don't send them to a surgeon. I send them to my good friend Randy Weinzoff. He's a chiropractor. He has healed almost every single one of the sciaticas and radiculopathies that I've sent him over many years. How he does that is very simple. He aligns the spine. That often gets rid of the stenosis. Okay, it gets rid of that pinch. He's in Santa Monica if you want to find him. Randy Weinzoff, great guy, and can help you if you're having sciatica. You can check in with me first for an examination to see if I can help and to see if it's something that needs to be sent out or not. So I'm going to give out the phone number, get some callers in here, and the phone number to call me right now and talk to me and ask questions. You can use a phony name. We don't have to know who you are. And you can pretend it's your mom or your dad or your brother or sister. If it's you, no one's going to know. The phone number to call me right now is 866-870-5752. And if you catch the show, sometimes it's publicized at other times than when we're live. When it's recorded, you can call me at my office and get more information. And the phone number to the office is 800-300-9300. 800-300-9300. And the website again, www.lastemcells.com. If you do call, I'm going to send you out a copy of my book, $25 value. I'll pay postage. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It's got sections and chapters on every part of the body, and it actually talks about using stem cells and platelets everywhere. I don't just do, necks or knees or hips or shoulders. I do the whole body, wherever there is pain, everywhere from basically the top of the head down to the bottom of the feet. And speaking about the top of the head, we do something with PRP or stem cells to regenerate hair follicles for people losing their hair. I know that you think that probably can't happen, but it's in the book. And there's a chapter about hair regrowth, and there's also a chapter on face regeneration. I regenerate the musculoskeletal system. My wife regenerates the face, and we can grow collagen in the face and make you look younger just using your platelets or your stem cells. So, Nita, I'm going to go to another question, if that's okay with you.
Yes, first please give the phone numbers.
I will. The phone number to the office is 800-300-9300, and to the studio to talk to us live is 866-870-5752. If you call, you get a free copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. Okay, so this question says, trying to prevent my dad from having back surgery. That's a very noble enterprise. I agree with this person. Would love to explore this route. Okay. So I get people in all the time that have had failed back surgery. What does that mean? A failed surgery is a diagnostic term that's used by insurance companies to say that someone had a surgery and it failed. It didn't get better or it got worse. Why does an insurance company have a diagnosis of failed surgery? Because too many of them fail. It's too common. I would say probably half the surgeries that I see fail. That's a big number. Why go through a surgery when you can just get an injection to heal the area instead of cutting open the body and taking tissue out? So yes, I save people from back and neck surgeries, any kind of surgeries, shoulder, hips, knees, toes, fingers, elbows, every day. They say I'm the busiest guy on the planet doing this work. I'm not sure that's true, but I am busy, and I've been doing this work 25 years. So it's something that's worked on my body. I've injected both my knees, both my shoulders, both my elbows, my right wrist, and I've had other doctors inject my neck and my back and my ribs, broke my ribs once, fell down the stairs, holding my baby Brittany and ham and eggs in the other hand, and I fell down the stairs, and luckily I was able to pull Britt close to my chest. Hi, Britt, I hope you're listening.
Oh, my goodness.
She's 21 now, but she was about probably like 8-9 months old then. And I pulled her just intuitively, pulled her close to my chest to protect her. And the ham and eggs in the other hand literally flew all the way across the living room.
Oh, my
and
gosh.
It was a big cleanup mess. And the kind of funny thing about it was my elbow hurt real bad because I fell on my elbow, banged up my back, but I wasn't aware of that. My elbow hurt, and I couldn't move it. And I was very upset because I was just about on my way to get a golf lesson. And that's an important thing for me. I love to play golf, and I love golf lessons. So I'm laying there, and my wife is watching. You okay, honey? Britt, okay? Yeah. And I said, but I don't think I'm going to be able to take my golf lesson because my elbow wasn't moving. I couldn't bend it. And then finally I loosened it up, and then I realized that my ribs were impossibly injured. And I didn't find out for quite some time. I got an x-ray because I couldn't move. It didn't show anything, really, because areas like the ribs don't show fractures often for about 2 or 3 months after they calcify where the break is. I went back months later to get a follow-up x-ray. Then I saw the excess calcium where the fractures had been. But I did heal it up. I had someone in my office inject me a few times on the ribs and got those better. So can it work in the back? Yeah. I do backs almost every day, if not every day. Necks, shoulders, hips, knees, fingers, wrists, you name it, I do it. So Nita, what do you have to say about all that?
Well, I would think that of all the thousands or millions of people in pain, they would want to be calling right now and talking to you at 866-870-5752. And if for no reason, then to get the free book and really get on board with this new revolution in orthopedic treatment. And your free book is called Stem Cell and Platelet Therapy, Regenerate, Don't Operate, with 264 scientific studies. And the foreword is written by the lovely Suzanne Summers, and you appear in her latest book called A New Way to Age.
Isn't she amazing?
She's amazing.
She's amazing.
But you're amazing.
Well, we all have our little piece in the puzzle, right?
Yes.
And after my residency at UCLA, I did a 2-year fellowship in natural medicine. It's something I've always been interested in. My grandfather was my mentor. He was a doctor born in the 1800s. And my mom would, I'd have to use the term, force me to be with him so I'd get educated at a young age. And it was pretty interesting. My job at his office, his medical office, was in his house. And so I would take the bus down to the south side of Chicago. We lived on the north side where he lived. And I'd spend the day with him filling up little bottles of cherry syrup. He had these big gallon bottles of cherry syrup. And my job was to fill up the big bottle into the little bottles. And guess what that was, Nita?
It was vitamin C?
Well, I never thought of that. There probably was vitamin C in it, but it was a placebo. That's what he would give to his patients. And he lived back in the day when doctors did house calls. So he would go from house to house giving out cherry syrup that I put in the bottles. And people don't know this, but 30 to 40% of the time that placebo is used, it heals. And people often say, is regenerative medicine placebo? And I go, I wish it were. I wish it were, because then I wouldn't have to even inject anybody. But we know with the studies that we do that there's a much higher rate than 30 or 40% healing with regenerative medicine of stem cells and platelets. It's up in the 80% to 90% level. So that maybe there's some placebo to it. Maybe there's some placebo to everything. Maybe there's some placebo to surgery too. I don't know. So here is a question.
Okay.
This says, my great niece has a torn meniscus. I'm glad she's great. I treat menisci all day long. It's one of the most common syndromes that people have. And I don't know what the percentage is exactly, but as we age, if we're active, almost everybody has a meniscal tear. It's just wear and tear. It's like a tire on a car that gets worn down. The meniscus is the cushion between the two bones in the knee, between the tibia and the femur. And it cushions the cartilage. And because of all the wear and tear of just literally walking around, if someone does sports, their chance of having a meniscal tear is huge. Does stem cell or platelets repair it? Yes, they can. And how many treatments would it take? I don't know. I had a meniscal tear in both my knees, and I could tell because I looked with an ultrasound, which I use to inject knees and shoulders, hips, and some other parts of the body. Don't get a shot in your shoulder by any doctor, or your knee, or your hip, and some other areas, unless the doctor is using an ultrasound, because they will not get to the proper area. And we fight it. You know, back in the day when we weren't using ultrasound, and then ultrasound came to be, we fight it. We go, I don't want to use that. I don't want to spend, $50,000 for an ultrasound machine, and I don't want to learn how to use it. And at my first ultrasound class, which was probably 15 years ago, the professor, I was sort of bucking him. I said, I don't need to use that. I know where I'm going. He goes, you don't have a clue where you're going. And it was a cadaver class. And he said, put that needle without the ultrasound where you think it's supposed to go. And then we're going to put the ultrasound on it to look at the needle and see if it's where it belongs. Guess what?
Guess what? You were wrong. Oh,
I
my
was
gosh.
wrong. And I had done thousands and thousands of what we call blind injections, thinking I was going to the right place. My results were okay, but nothing like they are today. And at our national meetings with regenerative medicine, we'd always query, why don't hips ever heal or rarely heal? And then I found out why. We were injecting in the wrong place. Hips heal now as much as any other part of the body. So be careful. Pick a doctor who uses ultrasound if you're going to get injections in the joints or the tendons or ligaments. The biggest failure rates in regenerative medicine, when you get it done and it doesn't heal, are either non-use of ultrasound, where the needle's going to the wrong place, too much activity. That's a common thing where I inject someone, they come back and they didn't stop doing the same sport or gardening or whatever it is, bending, lifting, stooping if it's a low back, taking anti-inflammatory medicine like ibuprofen. That blocks the inflammation that's needed to bring fibroblast to the area, which literally spit out new collagen and help the tissue grow. Not enough treatment, it's another reason. Some people come in expecting God to fly down on the chariot with the angels and get one treatment and then they fly away. And it can happen like that, but more often it may take more than one treatment. So you got to be careful what you're doing. Always pick a doctor that does the most of whatever it is you need. Check them out. Ask them. Be blunt. How many of these procedures have you done today? How many did you do yesterday? How many last week? How many last year? Break time.
It is break time. You're listening to Living Pain-Free with Dr. Marc Darrow. Grab a pen or a pencil. Write down this important information coming your way. I'm your host, Nita Valens, and we'll be right back.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.